we're talking about things that are symptomatic or asymptomatic. As it turns out, especially when you're dealing with an area that's closed, not soft, loose tissue, but very closed, surrounded by bony structures. If you have an infection that grows quickly, it puts everything on stretch. And stretch is what hurts. Okay, so when you have an infected tooth that just blows up in a few days, there's probably few things that are more painful. Mm-hmm. On the other hand, when you have a tooth that at some point in time dies, and then over the period of 6 months, a year, 2 years, 5 years, the infected contents gradually leak into the tip of the tooth and expand slowly, the body compensates. Nothing is put on stretch and there is no pain. The front cover of the book actually shows my friend's tooth on regular x-ray and on 3D. This one on 3D is so grossly abscessed, it's actually eroded away the bone, the bony floor of the sinus, okay? But that still is not acutely associated with pain. So one of the important messages of this book is that most physicians and most dentists have been laboring under a long-standing delusion an incorrect assumption that all infections are going to hurt. Mm-hmm. And that's absolutely not only incorrect, but it's actually the exact opposite that's true. When you actually count up in total all the different areas of your body that can be infected, including in your mouth, the vast majority of the time, again, 85, 90% or more, are asymptomatic and pain-free, but has nothing to do with their toxicity. So when you're an endodontist, it's kind of funny. Certainly most physicians and dentists that know my name around the world pretty much know I've been anti-root canal for 20 years following Dr. Huggins and everything else like that. But to any endodontist who still has his or her mind open, I would tell them right now, listen to what I'm saying when I'm talking about the number of teeth on the planet that are chronically infected, combined with the fact that most people are poor and they can't afford much dental work. They certainly can't afford an implant down the road, and they don't want to be missing a tooth. What does all this translate to? All this translates to is an effective, huge increase in root canal treatments for the endodontist if they actually read between the lines, because the world will be better served by chronically infected teeth having a expertly done root canal than have nothing done at all.